Trigger points. So trigger points, there's a lot of debate and discussion on what exactly a trigger point is. There's some schools of thought that say that so every muscle in your body has neurons that fire to tell them to engage. And so it could be anywhere from one neuron acting on as many as 2,000 to 3,000 muscle fibers, and so that's the case with quads, hamstrings, some of the larger muscles, or it could be one neuron acting on 20 muscle fibers, as such as the case with the eyes. Typically it's about 1 to 150 if we just kind of average out everything, all the muscles. So anyway, neurons fire on muscles. So let's pretend my fingers here are the motor neurons, and here is my muscle fiber. So all of them fire, boom, muscle engages. But what if you're overusing a muscle and just constantly, non-stop, overusing? Well, what can happen, some say, is you might actually, instead of all 5 aren't necessarily going to keep firing, but maybe 2 of them are going to keep firing just because they're constantly being stimulated. And due to that constant stimulation, it's creating this nodule that starts to form. And so that's why one of the ways to treat a knot or trigger point is to basically put compression down on the site. Because by compressing it, you're starving the impulses. Because in order for an impulse to continue to be sent, the cells need to be able to be nourished and feed into that impulse. So by compressing it, you're basically creating an ischemic response. Ischemia means a lack of oxygen. So if you sit on your foot for too long and then you get up and you've got pins and needles, a lot of what you're feeling, some of the pain you're associated with that is ischemic pain. So there's pain due to a lack of nourishment in that area. And so that's one of the thoughts. Another one is that it's maybe an area of excess stagnation, lactic acid. So over time there's an accumulation of cellular poop or waste that just continues to propagate, and it ends up leading to these nodules that start to form. And as a result, it starts to inhibit functionality and can cause all kinds of problems. So think about a swamp versus a moving river. It's said that where there's stagnation, there's death. Where there's movement, there's life. So in these little pockets of stagnation, you get adhesions that start to accumulate. And as mentioned in the adhesions talk, there's lots of different ways that can happen. Remember, there's either through dehydration, posture, overuse, trauma, things like that can all lead to adhesions, which can then in turn lead to the formation of a trigger point. All that said, bottom line is they do happen in the body, generally in areas where you're using those muscles a little bit more. So climbers, it's more common to get some of these knots, trigger points through here. Just about any activity you do, especially paddling sports, you're prone to get a lot of trigger points through your upper traps, your trapezius muscles. And so it can really happen in any muscle. And so what I'm going to highlight now is ways that you can calm these areas and actually dissolve these trigger points. So first things first, you want to make sure the tissues are warmed, because remember, warming up the tissues allows more oxygen and nutrients to be delivered to the cells to allow them to function a little bit better and to optimize the compliancy of the tissues. So first thing you're going to do is you can feel across the fiber. So I'm going to use the forearm as an example. The forearm, most people have about 24 muscles that attach onto or from the forearm. I say most people because about 12 to 20% of the population is lacking one of the ones in here called palmaris longus. And if you are lacking it, you don't necessarily notice any decrease in capacity and function. It's just something that is. Anyway, so you've got about 24 muscles that make up the forearm. It's surely inevitable, you'd think, that some of them might end up with a trigger point. So basically what you want to do, if you want to really identify it and isolate it, is you can start feeling across the fibers of that muscle. If it was the bicep, I'd feel across the fibers. You should be able to kind of pick out individual fibers as you strum across. And then you might notice, ooh, one of these is really, really tight. So I'm going to use some cordelette as my demo here. All right. So look at this, a nice happy fiber, nice happy fiber. All these I can very distinguish as I cross across them that, they are a muscle fiber. They feel good, they're not excessively tight, because remember, when you're palpating or feeling, you're doing it with the muscle in a relaxed position. So you shouldn't be engaging it. But then all of a sudden, if you come up to one of these fibers like, holy, look at this guy, he's super tight. Actually, these two, they're really, really tight. whereas these ones are nice and soft and supple. So that's the first thing. That's your first clue that you've got a knot, is you locate tension, a tender, you locate a taut fiber. Okay, so you find that taut fiber. Next thing you want to do is follow it down and along. So keep tracking it, keep going down with it, see where it leads you. And then, oh, there we go. Sure enough, there's a knot or a trigger point. And so again, you find the taut fiber, follow it to a palpable nodule, which is what this represents, so that knot or trigger point is palpable nodule. And then what you may notice is one of two things, not always, but you'll notice either referral pain when you press on it. So a very common referral pattern, for example, in the upper traps, is it goes around the back of your ear and down along to the side of your temple, almost like a question mark. So if ever you squeeze someone here and they feel pain going right over into this spot, good chance it's confirming that there is a knot in your traps. Another example, suboccipitals, tiny little muscles at the base of your skull. So if you feel the back of your skull, right where it converges at the spine, way up here, if there's excess tension there, oftentimes people will feel those headaches either right here at the very top of the head or right behind the eye. So that can be an indication that you've got trigger points in those areas. So anyway, referral pattern. So taut band, palpable nodule, referral pattern, and the fourth thing you might notice too is that it has a twitch response. You don't always get this, but meaning when I poke on it, it's going to start fasciculating or twitching a little bit. Okay, so those are your identifiable characteristics. Let's look at different ways we can release these or calm them, get rid of them, eradicate them, whatever you want to call it. So I'm going to follow it along. After having warmed up, of course, one of the ways you can do it is called muscle stripping. So I'm going to strip down along using gentle pressure initially. And with each pass, I'm going to go slightly harder, using a little bit more and more pressure each time. Remember our crucial considerations. You're well hydrated, and this is where especially so you're working with your breath. So I'm going to go nice and slow. And when I feel I'm starting to get closer to that tight nodule, just take a few breaths as you slowly pass over. And then eventually it might calm enough to where it literally will dissipate. You won't be able to feel it anymore. And so very important that you quickly follow that up by flushing. And when I say flushing, I just mean doing some strokes that go back towards the heart to help your body eliminate that waste that you've now kind of dissolved into the tissues. So helping your lymphatic system in your veins a little bit. And then also a little bit of range of motion, because the range of motion will help realign the muscle fibers. Okay, and you can even then follow that up, those two things up, with heat. Heat prevents what we call a kickback. Because if you just start using the muscle right away, it's possible that knot might just come right back. So we want to try and really limit the possibility of that. So a little bit of range of motion, some flushing, and stretching will be really important. Okay, so that's one of the ways. Another method that's commonly used to eliminate trigger points is called ischemic compression. So it just basically means poking it and staying there on the site. So ischemic compression, same type of protocol. The tissues are warm. You palpate, you find that taut band, you follow along. When you get to the taut band, or to the tender nodule, the knot, you're now actually going to put pressure onto the knot. You put pressure from anywhere to 30 to 60 seconds. You want it to be uncomfortable, but you don't want it to be painful. That's the hope. And you're going to wait 30 to 60 seconds. If it still hasn't released at that point, then just continue with the muscle strip. Do a few muscle strips, and then come back and sit back on that site. Wait again 30 to 60 seconds, and then try that a third time if need be. But basically the bottom line is you're trying to starve the area to really force it to just relax and to dissolve that nodule. Personally, just with clinical settings, a lot of the patients I've worked on, I find the best way to release a trigger point is actually a little bit of a combination of the muscle strip with the ischemic compression. I prefer not to go directly to the knot itself. I'll actually strip down And then when you feel you're at the border of the knot, start giving some compression there. And then what you can even do is just introduce a little bit of mobility at that site. Very gentle movement. So putting my little demo piece down, what that might look like is I find my tender nodule, my taut band, follow it along to the nodule, and let's say it's right here. I'm going to stop over here. Keep pressure, work with my breath. On the exhales, just do very gentle motion down. And return. I'll do that a few times. Okay, and then revisit it. Best done if you've got a little bit of lotion, or even if you have sunscreen, you can use that as your lubricant to get a little bit more glide. Revisit the area, again going to the border. So it's not, if I use the muscle as an analogy, I'm not going on the muscle belly and I'm not going on the tendon, I'm going on the muscle tendon junction. So I'm going to the border, which is the example here. So I'm going to the border of that nodule. Wait, do a little bit of range of motion. And then when it starts to dissolve a little bit more and more, then get right onto the knot and keep the compression. So there's lots and lots of ways. I'm only highlighting 3 little ways. The list goes on. There's a lot of merit to other things like known as ice and stretch, where you're icing it and then stretching it to dissolve these points of adhesions. But anyway, those are just the few that I found work quite well for me and the patients that I've treated. So that's why I'm highlighting them.